What if I told you that you could restore quite a bit of the youthfulness, glow, brightness, and some volume to your face with your own tissue in one sitting? Would you believe me? Or people were injecting filler into the face, and filler, Sculptra, these sorts of things that improve volume, they do a nice job for just like certain areas, right? Your temples, your chin, they can create nice shadow, nice volume. But the downside to filler, which a lot of people have found out, is that RegenGraft is yellow, it's fat. So fat in dark areas is going to look brighter. So in shadowed areas under the eyes or in pigmented areas under the eyes, in dark areas around the mouth, in fine lines around the mouth, these are areas that traditionally filler does not actually look that great. Because what if I told you that you could restore quite a bit of the youthfulness, glow, brightness, and some volume to your face with your own tissue in one sitting? Would you believe me? Well, I'm Prem Tripathi. I'm a board certified facial plastic surgeon in the Bay Area. And I want to go through actually a treatment that I have perfected and developed that I can do in my office. It's called RegenGraft. And I want to go through why I think it works really, really well. It's a natural result. It's done in the office, and it can take things like fat grafting, growth factor injections, and even the desire to have filler to a whole new level. So for a long time, surgeons were injecting filler, or people were injecting filler into the face, and filler, Sculptra, these sorts of things that improve volume, they do a nice job for just like certain areas, right? Your temples, your chin, they can create nice shadow, nice volume. But the downside to filler, which a lot of people have found out, is that they retain a lot of water. They can actually migrate and create some contours that you're not happy with, and they require a considerable amount of maintenance if that filler doesn't stay in position for a long time. And surgeons have always done facial fat transfers, and fat transfers are great, but they took quite a bit of years to really perfect. For a long time, fat transfers fell out of favor because fillers were a lot easier to do in the office. They started to make a resurgence because when combined with things like facelifting, the results were that much better. And now we've gotten to a point where fat transfers in the processing standpoint have gotten so great that they look a lot more natural. The fat can be thinned out, it can be thicker if you want it in particular areas. It can almost be devoid of a ton of living tissue in exchange for just growth factors when you want to inject it in areas like fine lines, wrinkles, those sorts of areas. Another downside of fat transfers is that sometimes you can't really be predictable with how long it's going to last. So you're taking living tissue and putting it in a new part of the face. You're putting it into the temples or the under eyes, and you're asking it to regain a whole new blood supply. So if you can imagine, living cells don't want to be taken out from where they're put in. And so if you're adding it to a new spot, the tissue around that area has to develop a blood supply for the fat cells and has to sort of mix in that milieu of tissue. And you're taking fat from the belly and putting it into a place where it hasn't been before, obviously. So that fat will take some time. And because of that, some patients will get fat transfers that last 2 years, some will get ones that last 5 years, and some really won't notice a ton of difference if their expectations are sort of not in line with what you can deliver. Another issue with that is that it can create nodules. It can create bumps, it can create little, spots under the eye that you can see. But the thing about RegenGraft is that I've controlled for a lot of these variables, and I want to go through them with you. One is that RegenGraft is a fat transfer system, but I also boost it with growth factors, and I process the fat in a particular way to thin it out in a way that it's going to last a long time, but not completely go away as quickly as other fat transfers have in the past. And the reason why I think it does a great job of controlling for variability, like not lasting long, having lumps or bumps, is because of those two things, boosting it with growth factors and thinning the fat out. We can also be a lot more precise with where we're injecting it. So in areas like the temples or under the eyes, you want to be very careful that you're not over injecting fat. But in these areas, we don't have to control and say that 50% of the fat's going to be gone in a year from now, because RegenGraft really allows for the fat to stay in the area for longer, and it can actually make the skin look a lot better because you're having those growth factors there. The last thing is the nodules, the dreaded nodules from fat transfers, where people used to just take fat out as a whole little blob and inject it back into the face. Now you've processed that fat out, you've smoothed it out, and you've ran it through a sieve. So when you do that, you're getting a lot lower risk of things like fat necrosis necrosis and nodules which form with fat. The last thing that I sort of build in as an insurance policy is how do we maintain this fat, right? So I do a boost at 6 weeks with growth factors and a 6-month RegenGraft boost. This allows the fat that's there to survive a little bit longer and to have a longer time bathing in those growth factors. And then if you need a small touch up around the eyes or in the temples or wherever you want to put it, it's given a little more boost there to give you that final result. Because look, in reality, I can do everything I can to control for that fat loss, but there's going to be a certain percentage of it that just doesn't survive. But by adding those boosting sessions, you're getting more fat to take in the area, and you're adding that insurance policy just in case you need it a little bit more. So what can RegenGraft do? There's a lot of things that it can do that you probably didn't even think about. It is not just a biofiller. It's not just a filler that's going to fill in volume. I really want to focus on the benefits of Regen filler or RegenGraft beyond just the usual filling. So of course it does fill. It's not like PRF where you get a little bit of benefit initially. It actually does fill things like temple hollows, under the eyes. You're not going to have to worry about migration. You could fill the nasolabial areas, chin shadows, jawline, all of these areas that you would normally use filler without the sadness of having it migrate. The added benefit though is multifold. So the second really nice area is dark areas, right? RegenGraft is yellow, it's fat. So fat in dark areas is going to look brighter. So in shadowed areas under the eyes or in pigmented areas under the eyes, in dark areas around the mouth, in fine lines around the mouth, these are areas that traditionally filler does not actually look that great because filler works well for hollow areas, but not for darkness per se. And the other thing about filler is putting it very superficially can lead to more risk of nodules. That isn't necessarily the case with RegenGraft because I can chop up those little bits of fat really, really tiny and put it in fine lines around the face. So I would really think that it goes well beyond just filler or biofiller or any of these types of products. The last piece of it is that it is a collagen builder. So you are stimulating collagen in the same way you're stimulating collagen with Sculptra or Radiesse because of the natural growth factors that you have in your body that are in the graft, but also the ones that we add. These are collagen stimulators that will continue to build collagen. And now when they're mixed into the vat, they're gonna hang around there a lot longer. The last and most obvious benefit is that RegenGraft also improves the quality of the skin. So not only are you getting volume filling and collagen production, you're getting skin quality improvement. This comes from your body's own natural growth factors, ones that are boosted in the product and the fact that it's yellow. So one of the reasons you can think about that your cheeks are bright and they reflect light really nicely isn't just because of the bone underneath. It is because there are nice big fat pads there that are yellow. They reflect light really nicely and they are plump. Areas that are devoid of that are like the temples and very quickly the corners of the mouth or under the eyes. And RegenGraft does a great job of softening that area. One really key part of RegenGraft is you can't really overdo it. So like filler, that sort of puffy, overfilled face, RegenGraft just doesn't do that. Your body will figure out how much to hold on to. The part that is injected, not all of it will stay, and it can be smoothed out a lot better than filler can. Okay, so let's look at a couple cases of some really nice RegenGraft done. So in this patient, she'd had a lower blepharoplasty, which is why you can tell that the bags are not there anymore. But the really thing that you need to look at is under the eyes, the texture and tone of the skin. So she has some sort of like darkness and crepey texture under the eye. And while I did remove a bit of skin, RegenGraft is doing a bulk of the legwork here in terms of making the skin look softer, look a lot smoother and more uniform. So while she has no more bag there, the skin is still going to look a little bit damaged and sort of sun damaged and hollow if that bag is just removed. The RegenGraft is really doing a ton of legwork here. The second case is a patient that had a blepharoplasty previously and in the past somewhere else, and she never had fat put in there. And here it's a subtle result, but you can tell that in even ethnically pigmented skin, RegenGraft does a really nice job of just smoothing out the skin and improving the discoloration. Now I am going to boost her results, so she is going to get a better result, but it's one, subtle example of how this can dramatically impact and give you a longer lasting result than something like filler. And it can be put in a place where filler can't really improve. Filler is not going to improve the quality of your skin like RegenGraft can. So in closing, what is RegenGraft? It's really a boosted fat graft with multiple different sizes of particles in that system that gives you the ability to have a longer lasting, very, very natural looking improvement in both in volume, improvement in skin quality, and improvement in brightening of the overall skin and the shape and contour of your face. It can be done in the office, takes about an hour, hour and a half to fully do the procedure under local anesthesia, or it can be really nicely done with other treatments like lower blepharoplasty, brow lifts, other treatments if you want a soft amount of augmentation. I do this, I specialize in it, I've done my best to perfect this technique, and it's only getting better. If you have questions, don't forget to like, subscribe, follow for more, leave a comment, and I'll see you guys next time.